Ladies and gentlemen of the bailiwick and beyond, welcome again. Welcome again to our most recent update in relation to COVID. Firstly, let me say something to our good friends, colleagues and members of the bailiwick in Alderney. Late yesterday, we had our first positive case of COVID. Now, Dr. Brink will speak more about that in a moment, but it is under control. Contact tracing has been carried out. The risk of further contagion, further spread is low. But that will be kept under review. Now, of course, Alderney, like everywhere else in the bailiwick, is under full lockdown. That will continue. But as I say, Alderney has its first case. We're saying to our friends, our colleagues in Alderney, because we are one bailiwick, you have the full support of all the people of Guernsey, public health authorities, the states of Guernsey and the Civil Contingency Authority. So we're with you, and you have our full expert in people, Dr. Brink and the others who will guide you through it. Now, I'd also like to say, of course, that we have, and you'll hear from Dr. Peter Raby in the course of this presentation, because we've had an outbreak in one of our care homes today. A number of cases have been identified. Again, that is under control. Again, matters are being resolved, but that is an issue that has cropped up this morning and has taken a great deal of our expert and our resource time. Now, tomorrow we celebrate, that's not the right word, we will have been in lockdown for 2 weeks. What we promised as a Civil Contingency Authority is that at this time we would review where we are. We did that yesterday. Now, the short answer is because there is still a risk of community seeding, of contagion out in the bailiwick and out in the island of Guernsey, we are not making any changes to the rules for the next few days. Now, that doesn't mean we're going to be in the same position in 2 weeks that we are now. We're hoping that the worst is going behind us. The figures are good, if there can be such a thing, when you're getting numbers of people with positive COVID tests every day. But they are under control. They're being well managed. What we're going to do is review where we are, that's we, the Civil Contingency Authority, with all the advice that we need in the early part of next week. And by next Wednesday, when we have our Wednesday broadcast, we should be able to announce any changes, what those changes are, and certain timings of them. Now, even they won't be fixed because there will be a developing process over the next 7 days. So over the next 7 days, and by this time next week, we will have a much better idea of the time frame and the way out of this lockdown. Again, no promises are made, but we do expect to be announcing changes on Wednesday. But sadly, just for caution, and we want to make sure that this virus and this outbreak of the virus is put behind us as soon as we can, we are saying that we are staying and maintaining the current position. Now, we hope and expect, with a reasonable fair wind, that we will be coming out of this lockdown in its various stages much quicker than we came out of the previous lockdown. Again, we can't guarantee any timeframes, but that is our expectation based on the practice to date over the last 2 weeks, where we are now and where we expect to be in the next week or so. So bear with us and be vigilant. Now, it's often said, I've made reference to it, that I am a Tottenham supporter. I don't know why I'm saying that after last night's result, but there we go. And the thing with a football supporter, we realise if our teams need to be successful, they have to keep possession, they have to take control of the game, and they have to eventually score goals. Our main and overwhelming goal is to control this particular outbreak, which first came to prominence 2 weeks ago, and to make sure, as best we can, that we don't have another one. So that's the aim. And of course, I'm encouraged in that because looking historically, Spurs won the FA Cup in 1921. So let's hope it can control this virus in 2021. I'm absolutely sure that the authorities can, and we will do so. Anyway, enough of me, because we're going to hear from the first of our experts today, Dr. Brink.
So thank you, Deputy Fairbrash. And I'm going to start off by summarising. So if we go on to the slide entitled Slide 1, what I'm going to start off by doing is giving you a summary of our cases since the 25th of January, so over the last week or so. So it's really important that we monitor this on a daily basis so that we can look at the trends and try and predict what our needs are going to be. So starting off on the 25th, we had that initial dip in number of positive cases, which we knew would probably come up again. But then going through to the 30th, 31st, and indeed onto the 1st, we saw cases in the 30s and 40s. But we always look at community seeding, and I'm going to come back and talk to you a little bit more about that in the next few slides. But if you then look on the 4th of February, yesterday, we had 17 cases, and we had 17 positive cases and 820 in total negative cases. Now, these results are encouraging. However, we have a very serious situation in the form of a care home outbreak. And I think that's really important that as we look at the figures, we also take the whole picture into account. So if we go to the next slide, please. So what I've tried to do, and this next slide is entitled Slide 2, what I've tried to do is divide the cases that we've had since the start of the pandemic on the 9th of March into 3 sections. And I've put the most recent, entitled Figure 1, at the top. So Figure 1 is January until present, and what it shows you is the total cases that we've had since the 22nd of January, but it also shows you how many recoveries we've got and how many active cases we've got. So just to remind you, an active case is a number of cases minus those who've recovered and those who have sadly died. So just to remind you how we do that definition. As you can see, we've had 379 cases and 361 of those are still active cases. If we go down to Figure 2, that shows a period of time from the 6th of September when we started our border testing policy until the 21st of January. And during that time, we had 58 cases, largely travel associated, other than the small outbreak that we had around about October last year, and there were no deaths associated. Now, you're well familiar with the figures from March, and that represents the first wave of infection. And there we had 252 cases, we had 238 recoveries, with a total of 14 deaths, 13 of which were directly attributable to COVID-19. So I thought to present the figures in this format, you'll then be able to monitor the figures as shown in Figure 1 as to what's happening now and what's of relevance to us now. And I thought that would be of interest to people living in the bailiwick. So if I can have the next slide, and that slide's entitled Slide 3. What this shows is the case breakdown. Now, what we're always concerned about is unknown community sources of infection. That's really important. And what you can see, if you look at, for example, the Friday the 29th, we had 44 cases, and 16 of those cases were unknown community source. If you go down to the 2nd, what you can see, 10 were unknown community source and 25 were contacts. So you can see the gradual shift to the more cases getting detected by contact tracing as opposed to being found as an unknown community source. And to remind you all, an unknown community source is a positive case that we can't link to another case. So if I can have the next slide, and that's entitled Slide 4. And if we then go on to yesterday's data, is we had a total of 17 cases yesterday, and of those 17 were contacts and none were unknown community sources. Now, what's really important as we move forward, we've got the issues surrounding the care home outbreak, which we need to focus on, but I also wanted to stop and talk a little bit about Alderney. Now, the case in Alderney was detected through our contact tracing processes. So this was a person who we identified as a contact, who went into self-isolation and were tested as part of our contact tracing self-isolation testing policies. So really important, this is how the case was detected. I also want to reassure people in Alderney that this person has done absolutely everything absolutely correctly, and not only did they adhere to the lockdown rules before we went into lockdown, but also they've adhered rigorously to self-isolation. So I think that's really important, and whilst the risk is not absence for Alderney, it is very low. But what I would say to people...
We'll come back with Dr. Brink. It's just a temporary hiccup, I think, with our technology, but we'll be there in a moment.
Right.
Carry on, Dr. Brink. So you were frozen in time for a second.
Oh, right. So just to the Alderney situation, as I said, detected through the contact tracing processes, detected through our testing policies. So it was a proactive detection of a case. The person has done absolutely everything that they should do, so 100%. And we think the risk to Alderney is very low. Obviously, it's not absent. And what we need to say is that we need to be extremely vigilant, all of us across the bailiwick, and if anyone has symptoms, they need to be tested for COVID-19. Really, really important. So if we go on to the next slide, which is entitled Slide 5, what this slide shows you is a graph of our progress over time since the 22nd of January. The green line shows contacts of cases. The orange line shows the unknown community source. And I'm going to focus on those two because what you see with both of those is a gradual flattening of that curve, which is exactly what we want to see. However, as I said before, we need to stay vigilant, really important. So if we go on to slide 6, now, this is a slide that I thought I'd share with you because it's information that we collect on a daily basis, which is the tests completed by the date of the swab, so the time we took the swab, by the request, the test request category. So why was that person tested? And what you can see there, you have symptomatic. In pink, you have the contacts of cases, travel, preoperative, critical workers, and then the other tests in grey, which are surveillance tests. Now, what you see there is a gradual decline in symptomatic testing and an increase in testing relating to contact tracing, which is what we'd expect to see. But we also don't want to be lulled in a false sense of security. If people do have symptoms, they do need to come forward for testing. And we'll then see whether this is a real trend or not. And if we go to the next slide, which is entitled Slide 7, so what Slide 7 shows you is an age profile of active cases. And with that, that gives us an idea of what the current profile of patients who have active COVID-19 in the community is. And that's really important because it helps inform our healthcare services, helps inform Dr. Raby and the hospital services. And what you see is a higher number of people in the over 80, in the over 70 age group. And we really do need to be extremely vigilant. So the conclusion is we are seeing some promising trends, but there are areas of concern. We are concerned that people come forward for testing, and clearly we're concerned with the current situation in the care home. So thank you very much, Deputy Fairbrash.
Thank you, Dr. Brink. I just take up, before I pass over to Dr. Raby, I just take up one of the points that Dr. Brink raised, and we cannot emphasise it enough. If you are symptomatic, stay at home, contact your GP or the helpline. Do not venture out into the community. Do not take a risk. So the symptoms are listed on the helpline, are listed on the website, but and I think Deputy Salisbury will make further reference to this issue again when she speaks. But keep safe, keep home. Well, that's what everybody should be doing anyway. But if you're symptomatic, please, please, please stay at home, contact the GP or the helpline. And further in relation to that, I mentioned before what we will be doing next week. And just to emphasise, we will have our regular 3 briefings at 1 o'clock on Monday, Wednesday, Friday, where we will update you. And we intend to have 2 Civil Contingency Authority meetings. That's one on Tuesday and one on Thursday. If we need another one in between or whenever, we'll have one. But that is our current modus operandi. Now, Dr. Raby is going to speak next, and he's going to tell you about the outbreak in the care home that was discovered today. Dr. Raby.
Thank you. The position of the hospital is that we have 5 patients in our COVID hot unit in Rock Ward, and we have 1 patient in intensive care, just as was the position yesterday. But things are changing in real time as we speak. And that's because we're dealing with this outbreak in a care home, which we've alluded to. We're going to be completely upfront with you about this. The care home involved is La Grande Lande in St. Saviour's. And it's important that you know that because we don't want everybody with somebody in a care home to be anxious at this time. What's happened is that we've had 2 residents and 2 members of staff that test positive in the last 24 hours, and we're dealing with that. I'm going to emphasize there's nobody involved who's unwell and needs hospitalization because of symptoms, but the entire staff of the care home have been identified as close contacts of positive cases and been put into isolation. We've been looking at whether we can staff the care home in any other way, and the answer is that we simply cannot provide proper staffing for that care home over the next week or 2 weeks, as the case may be. And therefore, we have taken the decision to transfer the entire resident population of that care home, which is 11 patients, into the Princess Elizabeth site and into wards at the Princess Elizabeth Hospital site. 2 of the residents have tested positive, and they'll be going into our Brock ward unit. They're not going there because they're sick. I emphasize that. And I understand that both patients are about 3 weeks after their first vaccination, which we would hope would offer a good deal of protection. But we're going to bring them into the COVID unit because they are COVID positive, and that's the best place for us to look after them. The other 9 residents have tested negative, but obviously have been in contact with positives, and they will be brought into wards at the Princess Elizabeth Hospital site, where they will be put into isolation, and everyone will be tested daily, so that we're keeping a really close eye on them. The important thing is that they are being kept safe and looked after throughout this. And that's the position. I'm just going to emphasize, even those who have been vaccinated must not become complacent. And most of all, if you have any symptoms, even as an essential worker, please don't go to work. Thank you. Back to Deputy Fairbrash. Thank you.
Very much, Dr. Raby. Very helpful indeed. Over to Dr. Cookby with all the way he's running the medical and his involvement in that. Deputy Broad will tell us more about the vaccination programme. Al.
Oh, thank you very much indeed, Peter, and good afternoon. On Monday, I provided an update on the ongoing vaccination programme, and I'm pleased to confirm that the programme has continued at pace. Nearly 1,200 islanders passed through the vaccination centre between Tuesday and yesterday, with even more scheduled for today, meaning that over 11,000 doses of the vaccine have now been administered. Full data will be published as soon as we can collate the data from our vaccinating partners and get into a regular pattern of reporting. We've spoken many times about the importance of vaccination. It really is our greatest weapon against the virus. Vaccination is both safe and effective, and it is really so important that islanders come forward for vaccination when invited. As I said on Monday, the Community Vaccination Centre at Beausejour was specifically designed to enable vaccinations to continue, even in the event of COVID cases in the community. The very latest public health advice is being followed to ensure it is a safe environment, and all those with appointment booked should continue to attend unless they are experiencing any COVID symptoms, however mild. I can't stress that enough. If you've got symptoms, please phone them in, and please do not go to the centre. Additionally, community nurses are working through a priority list to administer COVID vaccine to those islanders who are unable to access the vaccination centre. 100 islanders have been vaccinated within their own homes during this week, and work will continue over the coming weeks, vaccinating some of our older residents in their 80s and 90s who are, as I mentioned, are housebound or unable to get to the vaccination centre. There will be a media release shortly seeking people who we may not be aware of, who are being cared for at home, who may wish to be vaccinated. This is for those permanently housebound. It is not for those who might be temporarily self-isolating. And finally, as we come to the end of Children's Mental Health Week, I wanted to take the opportunity to thank health and social care staff working in the children and family services. They've adapted and evolved their services to support young islanders with the help of technology. Now, where physical visits are necessary, they have still been able to continue to provide this, and following public health guidance, ensuring that this important work continues. While the Kindred Children's Centre is physically closed to families, outreach support is being provided to families and children in need of support during this challenging time. Technology is also allowing the multi-agency support hub for children and vulnerable adults to continue to operate virtually, and social workers are working very closely with colleagues in education to support children who are not able to attend school currently, and as well as for those who may be attending from next week. Any concerns will be escalated and outreach support will be provided. So thank you very much, and back to Peter. Thank you.
Thank you very much, Al. Deputy Salisbury next, and she will update various matters, including our distance learning provision and also COVID symptoms, how you should react, what they are, etc. So, Heidi.
Thank you, Peter. Now, I will start by setting out on behalf of our education colleagues what's been done to support children and young people now. As you'll know, for the last fortnight, our schools have been providing a distance learning offer for children whilst their sites were closed. I really should make a point of highlighting the dedication and professionalism of the many staff across education who have worked tirelessly to pull together a distance learning offer. Next week, we're moving into the half-term break, but our education sites are reopening to provide childcare and supervision for the children of essential workers and to support some of our most vulnerable. I know that literally hundreds of education staff have volunteered to work over the holiday to do this and are being tested today and tomorrow in order to make sure they're not carrying the virus and can make it happen. Thanks to them all. The important message from education for now is that even if your child isn't able to attend school at the moment, your teachers and support staff are still there for you. Remember that all families will have already received the distance learning guidance of parents, and this outlines exactly the sort of learning that your child will receive whilst they're studying remotely. If you have any questions or concerns about this, now or in the future, please do contact your child's school. Our teachers are standing ready to support us all, and I'd like to thank them and their leaders on behalf of all of us for working so closely with public health and helping us to keep the island's children and young people safe and supported at this time. Now, talking about keeping each other safe and well, I think Dr. Brink and I have read through the list of COVID symptoms and urged people to contact our clinical helpline if they have any of them so many times. Many of you are doing this. Indeed, I know one young person called Tori who wasn't feeling too well and has done just that. And she's currently self-isolating with her family until she has her test later today. Thank you to Tori and her family for doing the right thing. That is what Guernsey Together is all about. However, we're still seeing examples of people who seem to feel it's not something that they should be bothered about. Worryingly, whilst I don't want to comment on the details of individual cases, we have seen some examples of people still going into work while symptomatic, which is causing the ongoing transmission of the virus, and that has to stop. Just because you're providing a service that is considered essential during this lockdown, it doesn't mean you're indispensable. If you have even the slightest symptom, call the clinical helpline or call your GP. But absolutely under no circumstances should you go to work or anywhere else. Stay at home. We're still awaiting formal confirmation of what strain of the virus we're dealing with, but it seems pretty obvious that it's a more transmissible variant, and it really is highly transmissible. If you have symptoms and you go out, you will put others at risk, both your work colleagues and those for whom you are providing a service. It can cause incredible disruption to a lot of people and ultimately keep us all in lockdown far longer than we need to be. Employers, worryingly, we're getting calls on our helplines from essential workers feeling under pressure to work, even though they have symptoms. I know you're having a tough time right now, and staffing is a massive issue, but your staffing problems will be far worse if COVID spreads amongst the people you still have working for you. Do not let your symptomatic employees come to work. It risks the health and lives of everyone who comes into contact with them, perpetuates the spread of the virus, and ultimately isn't actually good for business. So I will again unashamedly repeat the symptoms that you need to look out for. New and severe fatigue, new muscle ache for no obvious reason. It's a kind of non-specific stuff that makes you feel a bit under the weather, lethargic, no get up and go. Headache, like sinus pain, pain around the eyes, loss of smell and taste, sore throat, fever where you get high temperature and shakes and chills and you just can't get warm, shortness of breath, chest tightness, a continuous new cough, something different from the normal. And look out for the following in children in the over 80s. A loose stool, mild fever, just not being themselves and with a cough presenting later. Be vigilant. If you do start to experience any symptoms, no matter how mild, please do what many others have already done either phone your GP or contact the clinical helpline by calling 01481 756 938 or 01481 756 969. And I'll repeat those lines again, 01481 756 938 or 01481 756 969. You will be scheduled a test and must self-isolate whilst waiting for the result. We have people willing and able to help you. Please do the right thing and please do your bit for Guernsey Together.
Thank you very much indeed, Heidi. Last but not least, I'd like Richard tell us how we're using our testing capability and some other general issues which will be material to your interest.
Good afternoon. Work continues amid many other challenges to get things in place to be able to have a small number of children, vulnerable students, and the children of those families where both parents are essential workers who cannot work from Monday back into the education setting from next week. I'm very pleased the testing programme will see them all tested over 3 days, and that is commenced and making progress today. With regard to any concerns about Alderney as a consequence of the positive case we've identified, and with specific reference to education arrangements there, we would like to reassure families that we have agreed a testing system for staff and pupils who need support from the school next week, in much the same way as in place for our education and early years setting in Guernsey. We know school will be making contact with their community on Alderney and providing more information about this later today. We're also continuing to support key essential services with targeted testing. This has again proved invaluable. As you've already been aware, we detected one positive case on Wednesday night who wasn't symptomatic, but allowed us to close 2 stores quickly to deep clean, and the food retail staff from both stores put into a testing programme. The expansion of the East Arm facility is significant in supporting our expanded testing regime to employers and workers in the public and private sectors to keep vital services running, despite the high numbers of employees having to self-isolate. We've transformed the facility from what was specifically designed for fairly small numbers of incoming ferry travellers into a major asset in our on-island testing regime. That facility alone will be testing around 1,000 people over the next 3 days for testing. Indeed, we have no backlogs in our testing regime. I must thank the Welcome team who work at the site and our strategic technology partner who have very quickly redesigned the travel tracker to track and trace IT program to allow facilities to be used in new ways, responding to the very big challenges we're facing in such a quick time. A general point to anyone booked for a test, please, if you can, come by car. We understand not all can, so if you're coming on foot, please notify whomever is coordinating your tests on behalf of your employer, organisation, school or supermarket, so they can let us know in advance in order that we can put in arrangements in place to accommodate people arriving on foot safely. As we end the second week of this lockdown, we thank all our teams, all those in the private sector working in essential roles, all those working from home, and everyone indeed in the community. We've already achieved a lot in a very short space of time together. Some islanders may be concerned that they may see work being carried out on the large Premier Inn construction site. This is a complex major build which has had to go into lockdown very quickly. Given the scale of steelworks on that site, it is essential that the structure is made safe. Some limited work will continue to ensure that this is achieved to the right standards. I would, however, just conclude, and you're not going to be surprised by what I'm going to say, by emphasising the point made by Deputy Soulsby and indeed others on the panel. I've honestly been shocked by the number of cases identified to be positive. People have continued to attend their workplace and during contact tracing admit to having felt a little unwell prior to being contact traced and still having attended work. This not only presents the obvious risk to our community in continuing to transmit the virus, but through the requirements to contact trace and test, it puts a huge strain on our contact tracers and our testing regime. Simply put, if you are symptomatic or showing any of the signs described by Deputy Soulsby, do not attend your workplace or anywhere else and follow the well-published guidelines. We can't emphasise enough how vital this is in our success to suppress this outbreak of the virus. Thank you.
Thank you very much, Paul. And just to emphasise the point he's just concluded on, and that others have made, we'll get out of this lockdown if people are responsible and stay at home and report if they've got symptoms. Obey the rules, please. And just again, the other point that Paul was making in the conclusion of his statement, the Premier Insight, there's no favours there. We've had that checked by independent experts just to make sure, which was true, that the information we was given that the site had to be made safe. So we checked that independently. Now, members of the media, it's your opportunity to ask this galaxy of talent that appears on the panel any questions that you might want to ask. Yes, Ewan Duncan.
Good afternoon, Ewan Duncan from BBC Guernsey. Just a quick question about the care home. Obviously, we heard previously that all the staff and residents have been vaccinated. So what does this tell us about the transmissibility of the virus despite having the vaccine?
Dr. Brink?
Thank you. So I think the important thing is the main reason why we give the vaccination is to prevent COVID-associated morbidity and mortality, so severe disease and death. That's really important. There is some emerging evidence that there might impact on transmissibility as well, but there is a critical timing as well. So it does depend when, after the first dose of vaccine, you are exposed to the virus. So that can, if you're exposed in the first 9 days, you're unlikely to have significant protection then. So there are a number of variabilities, but the point about the program that we're running now is particularly to stop people getting seriously ill and dying. That is the prime aim of our vaccination program.
Jim Delbridge from Highland FM.
Thank you, panel. My question today is what provision is being made in school settings for vulnerable children of essential workers who are eligible for a place but cannot or will not take a PCR swab?
Presumably, Dr. Brink, you can tell us what will happen if they don't take a swab.
So you're absolutely right. There are some children that absolutely cannot take a PCR swab. So it's about a whole envelope of protection. So it's about protecting those children through a testing regimen of the teachers and staff surrounding those children. So that's the first thing. There are some children that you can persuade to have not a nasopharyngeal swab, but we're looking at alternative samples for those children. So, for example, we'll use a saliva sample sometimes, so it's more difficult for us to process in the lab, but we'll do that on individual cases. So we are ensuring that the teachers surrounding those individuals are on a testing regimen, and we're also looking at alternative sampling techniques, but we do acknowledge that there are some children that just simply won't tolerate any form of testing. So it's all about risk reduction rather than the elimination of a risk.
Juliet Puto.
Yes, hello panel, this is Juliet from the Guernsey Press. This week we've obviously seen a couple of supermarkets closed and deep cleaning taking place at those. It has, I think, raised a lot of people's awareness about obviously people touching things and then things possibly being passed on. I think people are very concerned about someone possibly touching a food stuff or post and then it being passed on. How realistic are those worries? Is there anything people can do to try and mitigate those risks?
Paul, first of all, could you tell us what happens when there's a deep clean to give people something?
Yeah, the deep clean is exactly what it says. It's absolutely everything. It's floors, walls, it's emptying shelves, it's re-cleaning, wiping down products. Everything is put back in place, literally from the top ceiling void down to the floor, and has to be done to a set standard.
Dr. Brink, do you want to add anything about, because Juliet's point about you could touch a tin of beans or something even though it's been, you won't get ill.
So one of the things that's important is the continued hand hygiene. So we'll reduce the risk of any transmission occurring by continued cleaning your hands, washing your hands, using your alcohol rub. So that is one of the most important factors in preventing transmission of the virus. The chances of someone having a can of beans, taking it down and getting a significant transmission from that would be very, very low. The most important thing is to just have your general important hand hygiene, and that will be a significant risk reduction.
So when you go home after shopping, you should wash your hands again. Al?
If I can just add on that, I think it's as I said, it's the hand hygiene in the supermarkets, and also when you go to supermarkets going shopping. Although we used to quite happily touch things on the shelves and look at it and read the labels, this is probably a time not to. Make your decisions almost before you get to the shop. Go to the shop. If you want baked beans, take the first baked bean tin on the shelf. Don't look at it, scroll it round a few times in your hand and then put it back on the shelf. So it's just being a little bit more savvy as how we do our shopping. I know it's a little bit different for us, but I think that's quite important. Thank you.
I think it's Kate Prout from ITV. Kate, is it you?
Yes, it is. Hello. Thank you for this. A question for Deputy Bourard. Can I just confirm that the vaccination figures, 11,000, includes the whole bailiwick and not just Guernsey?
That would be correct. It would be the whole bailiwick, but we're hoping to get a better handle to be able to report to you in a more consistent way, and that's something we're working on. But there's been so many different things happening at the moment. We've got to concentrate on the major ones, and the reporting side is probably just taking a little bit of a backseat. But it's something we want to get right on top of, so we can keep you advised all the time.
Three wise people, really, because you saw on the screen, Dr. Raby and Dr. Brink nodded their heads at the same time as Al was making his point, so that's really good. Matthew Leach.
Hello, Matthew Leach here from the Bailiwick Express. This is more of a message, I suppose, than a question. I spoke to the President of the States of Alderney this morning, who wanted to thank Public Health and the CCA for everything they've done for the community in Alderney. Was catching their first case a textbook example of how vital track and trace is?
I see everybody's nodding there, but Dr. Brink's got a hand up.
Yeah, absolutely. And I think one of the things that has worked really well for us, we've had a really close working relationship with Alderney. They're part of the Scientific and Technical Advisory Cell. They're part of all of the groups that we have. And both Alderney and SARC have had a major input into those groups. And we speak to Dr. Simmons, amongst others, on a regular basis. I think what has happened is that we identified the case, the contact tracing was textbook, the testing program worked, and all credit to Alderney because they rolled out that program in Alderney. So it's been a really great partnership working.
I'd just like to say, in relation to my chairmanship of the Civil Contingency Authority, the input from the Alderney and the SARC representatives, they're so keen to make sure that A, they're part of the bailiwick, and B, that they protect their community. It's a credit. I'm grateful to work with such able colleagues. I'm going to go to you and Duncan again.
Question for you, Dr. Brink. I appreciate you might need a crystal ball for this one, but many parents around the bailiwick will be wondering when their children can in fact go back to school. Obviously, we know that some children are going back next week, but how much of that is a test to see how quickly the rest of the bailiwick can go back?
I think as we roll out the testing program over the next few days in education, that's going to be really important, but also monitoring the numbers over the next 48 to 72 hours is going to be key for us. So I think we're too early to provide an absolute guidance to parents, and I know it's incredibly frustrating for them, but I think the events over the next 72 hours into early next week are going to be really important for us to provide more concrete information. And I'm sorry if that sounds like I'm avoiding the question, but that really is my honest appraisal.
I don't think it is avoiding the question, because what I said in my opening remarks is that we will have a review in the middle of next week, and that we'll have constant reviews. So we'll have more information as we're able to make decisions. But I'm going to go to Jim Delbridge again now. Jim.
Thank you. When is it likely that complementary health services will be allowed to open? We know there are people in the community who have acute pain, maybe they require physio or an osteopath. When will they be allowed to function again as normal?
Again, a good question. My milkman keeps asking me that. He can't get to the chiropractor. Heidi, did you raise your hand? Were you raising your hand?
Yes, I am, although I think Peter will be able to give far more detail. But I do know there's what we learnt from last time, put in a whole protocol in terms of those practitioners who could start operating. And just to go back to the previous question on this, what we learnt last time is also how we can probably move faster through lockdown and just re-emphasise what Nikki and Peter were saying. You know, if the figures and the numbers going like we are, it looks like we hopefully be able to start moving towards that next week.
Dr. Raby.
Thank you. Just to add to that, and Deputy Soulsby is absolutely correct. Firstly, we're grateful to the people in these professions who are being incredibly responsible. We understand that it's very difficult, and we're grateful for the engagement and help that we've had from that. Nearly all of these professional bodies have guidance for how cases can be handled remotely wherever possible, and remote consultations are incredibly effective for a lot of things. So by all means, contact your care provider for any remote consultations at all. Anything that's an emergency, then get in touch with us. I think contact your care provider first. If, as a care provider, you have an emergency case that you need to see face-to-face or needs to be seen face-to-face, we can deal with that. We are seeing people for emergency pain procedures in the hospital, and we can help. But just for now, we don't think it's wise for people to be attending these specialties at the moment while we've got community spread and even with the best practice. So we're keeping that under review all the time. For now, we're where we are.
Thank you very much, Dr. Raby. Juliet, your next question, please. Hello? Juliet, have you got a question?
Sorry, I'll unmute my mic. Sorry about that. Following the first outbreak, obviously a lot of work was done with care homes to obviously reduce risk and put in better practices in place. Do we know yet where the source of the new outbreak in the care home has come from, or is that investigation still ongoing?
Dr. Raby.
That's going to take some time to unravel. And all I'll say at this stage is the first positive test we identified was in a member of staff at the care home. But it's early days, and contact tracing's got a lot of work to do.
Thank you. Kate Prout.
No, I don't have any questions. Thank you.
I thought your hand was up. My mistake. But I know Matthew Leach does because his hand is up. Matthew.
Hello, yes, I do have a question. Do we know exactly how many children will be going into an educational setting next week?
I think we do-ish, don't we, Paul or Heidi? Paul.
Yeah, it's a little over 300 is what's listed for at the moment. Obviously, that is slightly reliant on obviously getting successfully through the testing regime this week, because the first thing we need to do, both with the teaching cohorts that'll be supervising and with the pupils that'll be going to the schools, that they've received a negative test result before they go into those sites.
You and Duncan.
A question about vaccines. We know that Jersey have announced that all over 50s are to have their first vaccination by the end of March. And the question in Guernsey that people would like to know is, when will the over 50s here have that? I'm aware that you have a timeline, obviously, but it'd be worth a reminder if that's possible.
Dr. Brink?
I don't have the timeline in front of me, but we are mapping out, because we're looking at elongating the time between the first and second dose. So we'll be doing some remodeling on that.
Thank you very much. Heidi.
Yeah, just to add, we are following, once we're getting the vaccine, we are using it. So we're getting regular supplies and using it as we do it. So it's not as if we've got a backlog of vaccine that we're not getting through. So it's not a race. I don't know whether there's any difference between ourselves, Jersey, and the UK probably at the moment, given how fast everybody's doing it. We're all working to the same supply line, and also comparing where one jurisdiction is to another can be difficult because, as Deputy Brewer just mentioned, we're waiting for figures to come through from our various partners, and we have been reporting on a Friday what the figure was on a Monday. So just need to be aware of that.
Juliette Couto, another question.
A bit of a follow-on question from the previous one, which I think was focusing on over 50s. There's obviously a lot of interest among the rest of the population about when they'll get an opportunity to have their vaccines. I know in the UK, the politicians have been saying, hopefully all by the autumn. They seem to have an idea of when it'll take place there. Do we have any sort of timeline here for when we should start being able to start rolling it out to everybody?
Of course. Dr. Brink.
I think that's a really good point, and I think the early data coming out on transmissibility is going to be key to that decision making, and I think we would look to move to a phase 2 of a vaccination program, phase 1 being priority groups 1 to 9, a phase 2 as soon as we possibly could. So as soon as the vaccine was available, we would look to move on if the available data supported that.
I think you've made the point just a question or two ago, Dr. Brink, about, some of the vaccines we're going to give, instead of having 2 quickly, we'll have 1 and a bit longer in accordance with the medical advice. So therefore, that means more people get vaccinated earlier, albeit they don't get their second vaccine till later. But assuming all is well and all is going well at the moment, when do we think that the first group down to the 50-year-olds will be done? I know you've answered that to a degree, but when will they have their first vaccine by?
We think, I can't answer that question. I don't have that data, but I can certainly get that data. So my apologies.
No need to apologise. I think it's just because people,
want to know.
So it's fine. I think Matthew Leach again. Matthew.
Yes, we've had some concern from essential workers regarding testing when in isolation. Can we have some clarification again why some people are called for day 13 testing and others not? I suppose that could be for Dr. Brink.
Yeah. So it'll depend entirely on what the risk assessment and what testing protocol people are on. So as we identify clusters, because we're trying to work through them as efficiently as possible, but also as safely as possible, we're doing a testing regimen for different clusters. So it depends entirely what the risk of the exposure is for us to then determine what the testing regimen will be. Some people are on once weekly, some people on twice weekly, some people on daily. So it depends entirely on what the profile and what the type of exposure was, and that will then determine the testing regimen.
Yeah, I mean, it's a good question, because I've had emails and texts from people being concerned that they've heard some people are getting tests and they're not. Now, they shouldn't worry, and really just say, please trust the public health team, because they know what they're doing. One person might be treated in a different way to another purely because of the circumstances. So really just trust Dr. Brink and her team.
You and Duncan.
Another question for Dr. Brink. Forgive me if this is incorrect, but I seem to remember the weekend we went into lockdown, you said that the community cases you'd found, the symptoms they were displaying were not typical. If that's correct, can you tell me what some of those symptoms were, and if there'll be an update to the symptoms that we can expect to see?
So it really is, what we're seeing quite mild symptoms. So, we're seeing quite a lot of lethargy, just feeling a bit achy, painy, not quite yourself. And so we're seeing that, and they seem to have that for about 24, maybe 48 hours, and then develop more profound symptoms like high fevers and so on, which is why we're asking people to be really vigilant for those early symptoms, because that then enables us to get onto testing and contact tracing really rapidly.
Juliette Couto.
Yes, so far we've been very fortunate in Sark and Alderney through their vigilance, not having had any cases there until now. If, unfortunately, anyone does need hospital care from either of those islands, will they need to come to Guernsey for that care? And if so, how will they be transported?
Then you,
Peter.
Oh, okay. Paul to Peter Raby rather than Peter Furbush. Paul, Dr. Raby.
Yeah, I was just going to add there is well in place procedures for the medical evacuation of patients that needing to come to Guernsey for treatment, and that takes on 2 or 3 different guises. If someone's just not very well, that can be accommodated, which is obviously different than if someone's been badly hurt in a road traffic accident. So there are those procedures in place, and working with the Minion Hospital and others and colleagues on Alderney, those arrangements will be put in place.
Thank you. Dr. Raby, do you want to add anything?
Just a little. We would transfer COVID positive patients from Alderney by boat or helicopter rather than use the Dorniers. And we have the medical cell have guidelines for management of COVID throughout the entire health system. There's a separate section for Alderney. It's been well worked out. Dr. Simmons has been involved in developing that, and we have plans in place to transfer at certain times for anybody who might need escalation to hospital care with COVID. It's all in place.
Thank you very much, Matthew Leach.
Hello. Have any further discussions been held on payroll support and the intention to publish business details if help is requested?
Yeah, that's really a P&R question, but it's a very fair point for you to raise now. The answer is those discussions are ongoing. What we've said in relation to the actual clawing the money back, if that's the right phrase, is that we're not going to do that. Be reviewed before the end of February, and so will issues about naming. Again, those are under consideration. They may not change. They may stay as they are. Ewan Duncan, you've got your hand raised again.
A question for you, Dr. Raby, is about the hospital and the capacity that we've got there. I seem to remember the first time we went to lockdown, it was roughly about 70, with about 17 on support. Can you give us an update on the numbers now that we will have the residents from that care home in the hospital?
In the Princess Elizabeth Hospital, we normally run at about 100 open adult beds, so taking 11 patients in is something that we need to, it's not being done lightly. But we've got plenty of capacity at the moment, actually. The Brock ward will take these 2 more, so that will take it up to 7 patients. We can take up to 20 in there. We've got capacity in other wards. We're not running at black or red or even amber at the moment. So we can do that. We have further expansion plans in place if we need to. So at the moment, capacity is there. We're not worried. We've got plenty of scope to expand if we need to. Our staffing levels are good. We've had lots of staff come back today, actually, after all the dance festival things. So lots of things going well, and yeah, we're not too anxious. Thank you.
Do you have another question, Juliet?
Yes, we've had contact from some parents of university students who, of course, are semi-living off island currently to do their studies. Will they be able to be vaccinated in the UK, or will they need to come back to Guernsey to be vaccinated?
Dr. Brink, do you know the answer to that question?
So at the present, they probably wouldn't fall in the priority group unless they fell into category 4, which is clinically extremely vulnerable. So that's people with cancers and transplants and so on, or into category 6, which is the vulnerable group. So those include people with various respiratory symptoms and so on, so various respiratory conditions. So it would depend if they fell into one of those groups. So with regard to those, if they were off island, I would expect them to get called through their student health or whatever GP that they're registered with there. However, if they're back in Guernsey, we would administer the vaccine here if they fell into one of those groups. But I think it's going to be a minority of individuals. But if there are any specific cases of concern that are falling between 2 stools and fall into either a category 4 or category 6, we'd really like to know about those cases.
You, Matthew, sorry, Heidi, yes. And then Matthew, we'll come to 2 o'clock. Yeah, Matthew, sorry, Heidi.
Just thinking of, in terms of timelines, it would be probably quite likely that if it got to that age group, it'd be around about the summer anyway, wouldn't it, Nikki?
That would be for a phase 2 of a program, but I'm talking about phase 1, the priority groups 1 to 9. Any under 50 would have to be in the clinically extremely vulnerable group in phase 4B, or alternatively in priority group 6, which is the high risk group. So if someone was under 50, they would fall into those two groups. And what I'm saying is I wouldn't want one of those people not to have their vaccination. So if there are parents with specific concerns about a child falling in either the extremely vulnerable group or the at-risk group, we need to know who these students are so that we can ensure that they do get the vaccine. So I think this raises actually a really important point. And so we do need to know about such individuals. If we go into a phase 2 of the vaccination program, that's population-based immunization to include under 50s, yes, that would be towards the summer.
Thank you. We're going to come up to 2 o'clock, and I'm not going to carry this on beyond 2 o'clock. So those who've still got their hands raised, get your best questions asked in the next 5 or 6 minutes, please. Matthew Leach, what's your next best question?
Well, I only have 2 left, so I'll try and make them both quite quick. Have we seen any examples of long COVID cases, and what kind of support are we preparing for people suffering this way?
Thank you.
Yeah, so yes, we are seeing people that are reporting long COVID type of symptoms. So there are a number of ways in which we're looking at it. Is primary care, how they can help such individuals, but also they're referring some to our respiratory physician at the medical specialist group as well, some with sort of persistent shortness of breath and so on. So a number of investigations are being done, primarily managed through the primary care, but also working with the MSG.
Ewan, Duncan, your next question.
A question for you, Dr. Brink. What percentage of the COVID cases that we've seen in this second wave have actually been asymptomatic?
That's a really interesting question. We were actually discussing that at our public health huddle, which I hasten to add is a virtual huddle, which we have once a day. And a lot of people, we think, are symptomatic this time. But what we're seeing, as I said, is very subtle sort of fatigue, not feeling quite myself, got a bit of aches and pains, going to more symptomatic. But we're going to do a specific analysis of that because we think there's a higher percentage that are symptomatic this time, but we need to look at it in more detail.
Juliet Couto, when you have your huddle at the Guernsey Press, hopefully it's a virtual huddle when you prepare your questions. What's your next question?
Yes, in my virtual huddle this morning, one of my colleagues actually asked me to put forward a question. And it was actually looking at flu cases that have been going on in the island. Obviously, everyone's been busy washing their hands. Has this seen a reduction in the number of flu cases this year? Because obviously we're having less contact with people and hopefully being better hygiene. Has that been shown out in the figures?
Good question.
Yeah, I mean, we've had very few flu isolates this year, but we have been focusing on COVID testing. We've had a couple of cases where someone had a respiratory tract infection and they actually tested negative for COVID and then subsequently tested positive at a later stage. So clearly had 2 issues going on. So we just don't have the data. If we look at the respiratory symptoms, there's not much to show that there's been a lot of activity, but we just don't have the hard data to support that. But I think the hand hygiene and so on has been really helpful to prevent transmission.
Thank you. Matthew Lynch, and I know you said this would be your last question, so Matthew.
I promise it is, and this is my last question. I've got a question from the public. How reliable is the test, the PCR test that we're using, and can it ever produce false negatives?
So it's extremely reliable. It's the gold standard of testing. And not only do we, our PCR testing targets 2 different regions of the viral genome. So if you get a miss on one region, we've always got a second region to look at. So it targets 2 regions of the genome. It's highly sensitive. There's always a potential to get a false negative if the sample wasn't taken properly. There's lots of reasons, but it would be extremely unlikely. So over 99% sensitive. So it's a really sensitive assay.
Thank you very much. Thank you, panel. Thank you for all your questions from the media. We'll be back with you again at 1 o'clock on Monday. We will be reviewing the situation. We will have further news as and when it crops up, as I said, whether it's good or bad news. Just finally emphasising the point again, if you've got symptoms, stay at home, contact your GP, contact the helpline. Have a good weekend, everybody, and speak to you next week. Thank you very much.